Good morning. So this short lecture is on the Universal Healthcare Act or Republic Act 11223. So di ba madali siyang tandaan kasi 11223, madali siyang i-memorize if ever this would be asked in the exam. So this was enacted last February 2019 by President Rodrigo Roa Duterte, and the implementing rules and regulations of this act was signed by Secretary Duque in October 10, 2019. So, first, why is there UHC? So this is a provision in the Philippine 1987 Constitution. It was stated that health is a right of every Filipino citizen, and the state is duty-bound to ensure that all Filipinos have equitable access to effective healthcare services. So when we say it's a right, okay, ang kabaliktaran nito ay privilege or pribilehyo. So if it's a basic right, this shouldn't be questioned. Dapat lahat ng tao ay nakukuha ito. However, the reality is, alam naman natin that the poor cannot afford basic health care. Okay, the picture there below shows a powerful message on reality, equality, equity, and liberation or justice. So the purpose, UHC, as we can see later, something that will address that. So UHC or Universal Healthcare as defined is provision to every Filipino of the highest possible quality of healthcare that is accessible, efficient, equitably distributed, adequately funded, fairly financed, and appropriately used by an informed and empowered public. So kung makikita natin, ibig sabihin nito, wala dapat obstacles na humahad lang dun sa mga tao para makamit yung basic healthcare. Okay? It should be adequately funded. Ibig sabihin, merong pondo, may pera for this. And that, okay, it is fairly financed. Okay? So the Philippines uses universal healthcare interchangeably with universal health coverage. So, na-sign lang ito last year, 2019, but it took almost 50 years going under different names for this to be realized. So, it started 1969 as the Philippine Medical Care Act. The focused area here was financing. In 1991, meron tayong Local Government Code, which devolved health to the local government units. So, from the national government, di-download sa mga local government units ang health. Kaya, if you have done your duty in our barangay health stations or rural health units, makikita nyo na these are under the local government unit. So, na kay Mayor and the SB, yung pag-allocate ng funds for health. Okay? Though, andun pa rin yung support ng DOH. So, technical support is provided by the DOH. Okay? In 1995, we have the National Health Insurance Act or PhilHealth. In 1999, the Health Sector Reform Agenda, which is a policy framework or nagagamit ito to guide yung paggawa ng policies. Okay? For 2005, we have the Formula 1 for Health. 2011, Kalusugan Pangkahalatan or KPUHC. 2012, the Sin Tax Reform Act was enacted. 2013, there were amendments to the PhilHealth law. In 2016, there is the Philippine Health Agenda, which is up to now, ito yung ginagamit na policy framework. In 2018, we have the Formula 1 Plus. Okay, it's a strategy for health. These terms may be very overwhelming or confusing, but it helps to have time to do some extra readings on these. These are terms that you will meet in your primary health care. And as observed, our board exams already inclusive of these community health programs or public health programs, that it's a good thing to have knowledge on these. Ano ba yung mga ito? Okay, so the focus of our discussion is on the UHC. For these other policies that were enacted throughout the years, maybe you can allot a little time to read on this. Okay? So, why UHC? So, firstly, syempre, maraming Pilipino ang poor pa rin. So, this table is from the National Health and Demographic Survey conducted in 2008. So, we can see there are 5,218,267 families who have monthly incomes of 3,460. This is way below the needed funds to support a family, di ba? And then, though there are many middle-class families, these families are not protected whenever there is a disease or illness that affects one family member. Lalo kung long-term yung illness, di ba? Hindi na-insulate from poverty yung middle-class families. In this pie chart, we can see the distribution of health expenditure by source of funds. So kapag gumagastos ba ang isang pamilyang Pilipino for health, where do the funding come from? So where does the funding come from? As we can see, the biggest slice of the pie is out-of-pocket spending at 54%. So, ibig sabihin nito, kapag nagkakasakit nga ang isang Pilipino, 'di ba? Madalas ito ay galing sa sariling bulsa. So, paano pa kaya yung mga walang bulsa or yung mga walang ibinulsa for healthcare expenditure, yung nabubuhay lang na yung kanilang money is enough to get by in a day. Pagkain lang, ganyan, the basic necessities of life. And then, as we can see, napakaliit lang yung galing sa social health insurance. So, the national government, local government, each at 13%. For others, these are private donations, okay, at 11%. So, makikita, out-of-pocket spending pa rin ang pinakamalaki, pinanggagalingan ng perang panggastos para sa health. In this next pie chart, we have a distribution of health expenditure by use of funds. Saan napupunta yung pera na pinaggagastos for health? So, nandun ang pinakamalaki is on personal healthcare, 81%. Then, next is yung ating public healthcare ay 9% lang. Okay? So, maliit lang yung napupunta for public healthcare. Next is, so, if universal healthcare pushes through, which we hope will really push through, ang mga SDGs na maapektuhan or matutulungan para makamit natin yung mga SDGs ay SDG 1, 4, 5, 8, and 16. And syempre, SDG 3, which is good health and well-being. So, I hope that we are familiar with these sustainable development goals. So, we had Millennium Development Goals. So, from that, extend into Sustainable Development Goals. Naging mas marami na rin kasi mas naging exclusive and inclusive rather and specific yung ating SDGs. So, ang ating universal healthcare will have impact on these 1, 4, 5, and 8 and 16. No poverty, quality education, gender equality, inclusive economic growth, and inclusive societies. So, in our next slide, we can see that the agency that was mandated to be the financer of universal healthcare is the PhilHealth. So, hindi ibig sabihin naman na financer is sa kanila talaga mismo makukuha yung pera. Okay? Dahil sila mismo ay may pagkukunan din ng pondo. And they are the ones mandated, yung PhilHealth ang mandated to do the allocation. Okay? So, I grab this screenshot from the website of PhilHealth, and this is the mandate of PhilHealth. The NHIP was established to provide health insurance coverage and ensure affordable, acceptable, available, and accessible healthcare services for all citizens of the Philippines. So we hope that PhilHealth will live to its mandate. Okay. In discussing the universal healthcare, this cube is very important. So ano ba yung ibig sabihin nito? In the x-axis or your horizontal axis, x-axis yung pahalang, okay, you can see their population who is covered. Okay? In your y-axis, or ito yung patayo, you can see direct costs or proportion of the costs covered. And then, we have here the z-axis. Okay, ang z-axis natin is services. Which services are covered? Sabi niya dito sa ating screen. Okay? So, in moving towards universal healthcare, kailangang mai-extend natin yung cube. So, in population, dapat mas marami yung magiging covered ng ating insurance program. Okay? In services, dapat mas maraming services ang mai-provide, which will be shouldered by our insurance program. And dito naman sa ating y-axis, dapat mas mataas yung naibibigay na pera, okay, to cover yung healthcare cost. So, more on this one, okay. So, we need to expand priority services, di ba? Anong axis ulit natin yung services? It's the z-axis. So, we need to expand priority services. But the question is, which services are to expand first? Ano ba yung unahin natin na i-expand? And then, including more people. Diba ang x-axis natin ay population. So, in UHC, all Filipinos will be included in the insurance program of the government. But, the critical choice is whom to include first. Sino muna yung mga mauuna? And then, in reducing out-of-pocket spending, OOPs. Okay? So, that will deal with our y-axis. Okay? So, how do we shift from out-of-pocket spending toward prepayment? Pag sinabi mong prepayment is that nagbayad muna bago pa mangyari yung pangangailangan. Okay? So, in here, in expanding priority services, okay, the services are categorized into high priority, medium priority, and low priority. So, alin dyan ang mga services natin under our public health? Ang high priority, medium priority, and low priority. Next, also, na kailangan nating isipin in expanding our services is syempre cost effectiveness, priority to worst off, and financial risk protection. So, ang ibig sabihin lang nito is that alin ang services na mas kailangan ng mamamayang Pilipino. Okay? And the other part of the UHC cube is the x-axis, which deals with the population covered. So, UHC, Universal Healthcare, aims to include more people. So, in here, low-income groups, rural populations, and other groups. So, other groups disadvantaged in terms of service, coverage, health, or both. So, are you familiar with the term na GIDA? Geographically isolated and disadvantaged areas. So, makikita natin kung ano ba yung mga GIDA mamaya. And then, syempre, we need to reduce out-of-pocket payments. We shift mandatory prepayment with pooling of funds. And then, yung pagbabayad dapat should increase with ability to pay. Ito yung sinasabi ng UHC. So, habang makikita natin mamaya sa implementing rules and regulation na habang mas mataas, habang mas tumatagal, ganyan, mas tataas yung contribution ng members. Okay? And then, access to services should be based on need and not ability to pay. Sabi nga natin dito, that health is a right of every Filipino and it must be accessible. So, services should be based on need. Pag kailangan mo, dapat ma-access mo yun. Hindi dahil wala kang pera, kaya hindi mo ma-access yung isang service. Okay? Or, have you ever experienced going to a hospital and then bibigyan ka ng choice na ito na lang kasi hindi natin afford. So, iba parang nagbibigay na lang ng options. Tapos ang isipin na first factor ay budget, diba? So, okay, how can we reduce out-of-pocket payments? This is just a reiteration of the previous slide na makikita nga natin na 54% ang out-of-pocket expenditure natin for health. Napakaliit lang yung naibibigay na pondo for health from our government. Okay? So actually, this slide sums universal healthcare. Kung makikita natin, we have our health system building blocks, which are governance, health workforce, health financing, essential medicines and technologies, health information system. Okay? So these are our health system building blocks. And then this health system building blocks will be integrated into the action domains of the universal healthcare, which are sustainability and resilience, quality, accountability, efficiency, and equity. And then, the expected outcome and impact is to reduce health risks and improve health, to have equitable health outcomes, and improve financial protection across all conditions. Okay. So, how do we integrate the universal healthcare at the PHC level? So, I hope that in your discussion in primary healthcare, familiar na kayo dun sa ating organizational chart. So, alin yung under ng local government unit, alin yung under ng province, alin yung under ng DOH, okay? So, dapat familiar na tayo. So, under the MHO, okay? So, sino ba yung head ng MHO or Municipal Health Office? Yung ganyan na organizational structure, we need to be familiar with that, okay? So, this slide just means that integrated or ibig sabihin, there is multi-sectoral linkages. So, makikita natin dyan that the Department of Finance is involved, the DOH is involved, okay? And doon sa baba, makikita natin yung local government and then the healthcare providers down there. So, as we discussed, yung implementing rules and regulation, we need to be familiar with this definition of terms. So, una, primary care, it's the initial contact, accessible, continuous, comprehensive, and coordinated care that is accessible at the time of need. Important word here is initial contact. So, halimbawa ang pasyente, pupunta siya sa isang tertiary hospital, yun ang first contact niya. Considered pa rin yun na primary care kasi yun yung initial contact niya. So, do not be confused dun sa levels ng, di ba? Meron tayong primary, secondary, and tertiary levels ng care. Okay? So, in this, sa IRR, ito yung definition nila. For primary care provider, it is defined as a healthcare worker with defined competencies who received certification in primary care as determined by the DOH. So, this can be doctors, nurses, midwives, community health workers. And then, we have the healthcare provider network. So, ang mangyayari kasi sa UHC is that meron tayong magiging primary care providers. So, bawat pamilyang Pilipino, bawat Pilipino ay naka-register sa isang primary care provider. And these primary care provider will act as the navigator and coordinator of healthcare within the network. So halimbawa, pupunta ka magpapacheck up sa iyong primary care provider and you need to be referred to a higher level facility, say for example, a provincial or a district hospital. Okay? So, your primary care provider will be the one to refer you. Okay? And that your records is with your primary care provider. So, the information there is relayed to the higher facility which will accept you. Okay? And then, we shall see the role of the primary care provider more later. So, in the Essential Health Benefit Package, ito yung definition niya. It's a set of individual entitlements covered by the NHIP, which includes primary care, medicines, diagnostics, and laboratory and preventive, curative, and rehabilitative services. So, pag pupunta tayo sa mga hospitals, sa community, maririnig mo tong package na to, PhilHealth package. Okay. Ang nangyayari dyan is that per sakit, halimbawa, dengue, merong package yan. So, example, 30,000 ang allotted na package sa dengue. So, kapag nagkasakit yung isang PhilHealth member, isang Pilipino ng dengue, automatic na 30,000 yung ibibigay ng PhilHealth doon sa facility kung saan man siya nagpagamot. Okay. So, there's a benefit package. So, this includes medicines, diagnostics and labs, yan, and other services. Okay. And we also have population-based health services and individual-based health services. Pag sinabi mo na population-based health services, these are the health services na it has population groups as recipients. So, example is health promotion, disease prevention, disease surveillance, and vector control. Ito yung mga health services na ang tutok ay mga population groups as a whole. Individual-based health services pertain to interventions that can be traced back to one recipient. So, ito yung mga services that has limited effect at the population level. So, individual. Okay? And we have here geographically isolated and disadvantaged areas or GIDAs. Diba? These are barangays specifically disadvantaged due to presence of both physical and socio-economic factors. So, if you meet this term, GIDAs. So, these are barangays. Okay? Kailangan daw na both physical and socio-economic factors ang meron para masabi mo na GIDA yung area na yun. So, ano ba yung what is the significance of a barangay being tagged as a GIDA or geographically isolated and disadvantaged area? It is because these barangays are the ones that are being prioritized doon sa health services given by the DOH. Okay? So, pag sinabi mong physical factors, ito yung mga factors like distance, transportation, yan, geographic characteristics, masyadong bulubundukin kaya hindi nakaka-access ng healthcare services kasi malayo sila sa mga sentro or mga health facilities. Okay? When we say naman socio-economic factors, yan, sa poorest of the poor, those living in the slums, ganyan. Okay? So, let's go to our discussion on the UHC population coverage. So, nasabi nga natin kanina, since health is a basic right, the universal healthcare aims to have every Filipino citizen included in the National Health Insurance Program. So, para pag pumunta yung isang Pilipino sa hospital or sa health facility, hindi na siya tatanungin kung may PhilHealth ka ba, okay? Because in UHC, lahat na ng Pilipino ay may PhilHealth. Okay. But it doesn't mean that in UHC, everything is free. So, makikita natin saan ba manggagaling yung funding mamaya. In service coverage, it's stated in the law that all Filipinos shall have access to preventive, promotive, curative, rehabilitative, and palliative care for medical, dental, mental, and emergency health services delivered as population-based or individual-based health services. So pag ito, sa service coverage, ang ibig sabihin lang niya dito is lahat din ng Pilipino ay meron sanang access sa kanilang pangangailangang pangkalusugan. So for these health services, it should be determined through a health technology assessment. So, ano ba tong health technology assessment? Diba, ang dami nating terms under UHC. But it's good to have an idea on all these. Okay, so sabi dito, in 2 years, outpatient benefits should be included in the service coverage. Kasi at present, ang nabibigyan lang ng pondo ng PhilHealth ay kapag na-admit yung pasyente. So, kapag hindi siya na-admit, automatic out-of-pocket spending yan, di ba? Kung magpapalaboratory lang siya, babayaran niya automatic yung fee ng laboratory kasi hindi siya na-admit. Okay? So, in 2 years daw, sana, under the UHC law, ay kasama na yung outpatient benefits. Okay? Hopefully. And then, under the UHC, ito nga yung sabi ko kanina, every Filipino shall register with a public or private primary care provider of choice. So, yung pamilya mo or ikaw ay nakaregister sa isang primary care provider who shall be your first contact when you need healthcare. So, siya yung hahawak ng record mo, siya yung magre-refer sa'yo, okay, di ba? So, siya yung magna-navigate sa'yo sa health, sa levels of healthcare. If ever you need to be referred, okay? So, yung primary care provider mo ang mag-a-assist sa'yo, okay? So, the financial coverage, so pag population-based health services, ang financing nito ay national government through the DOH. Okay, provided free of charge at point of service for all Filipinos. Diba, ang sabi natin mga population-based health services, ito yung mga interventions which cater to the general public. Kasi may impact yung mga services na ito sa general population. For individual-based health services, ito ay financed through your prepayment mechanisms such as social health insurance, private health insurance, and HMO plans to ensure predictability of health expenditure. So, madaling sabi, kapag hindi population-based health service, ang gagastos nito ay ang prepayment mechanisms natin. So, may mga contributions. Okay? So, in the National Health Insurance Program, dalawa ang membership. We have the direct contributors and indirect contributors. Pag sinabi mong direct contributors, these are employees, kasambahay, self-earning individuals, professionals, OFWs, Filipinos living abroad, Filipinos with dual citizenship, lifetime members, and all Filipinos above 21 years old who have the capacity to pay premiums. Actually, this is what is causing ruckus, diba? Nung nalaman ng mga OFWs that they are required to pay their PhilHealth premiums before mabigyan sila ng certificate, yung overseas employment certificate, diba? They protested, okay? Kasi makikita natin mamaya kung magkano nga ba yung kailangan yung bayaran as premium. And also, Filipinos living abroad, okay? So, they are also required by law to pay their contributions to PhilHealth, okay? So, for our indirect contributors, these are those whose premium shall be subsidized by the government. So, these include indigents, the 4-piece beneficiaries, senior citizens not currently covered by the program, persons with disabilities, all Filipinos above 21 years old without the ability to pay premiums, SK officials, those previously identified at point of service or during registration, members previously sponsored by LGUs, and those who are not yet in the PhilHealth database and are financially incapable to pay premiums as determined by the DSWD. So, DSWD ang magdedetermine kung sino yung mga hindi kayang magbayad ng kanilang premiums or contributions. Okay? In our next slide, ito yung sinasabi ko na required by law na monthly premium rates. So we have here are the income floor and the income ceiling. Ito yung monthly income ng isang pamilyang Pilipino or yung mga direct contributors na sabi natin kanina. So, per year, yan, from 2019 to 2025, meron tayong increase in the percentage of contributions. So, for this year, 2020, 3%. Okay? So, yung income na 10,000 up to 60,000, okay, babawasan ng 3%, or 3% of the income will go to the insurance program. Yun yung babayaran ng member. Okay, that's why marami ang nagproprotesta kasi masyadong malaki ito, okay, na premium rate natin. And our OFWs also need to pay this, okay? And mind you, meron sa ating IRR na kapag hindi sila nagbayad, hindi nga sila marireleasan ng overseas employment certificate. At the same time, when they pay, they will pay a interest. 3% yata yung nasa IRR. Yes, it's 3% yung interest per month. Okay? Kapag na mismo mabayaran. Diba? Masyado siyang malaki. Kaya we can see a negative reaction lalo from our OFWs. Okay. So in the UHC, there is also the no co-payment policy. Sabi dito, there are no fees or expenses including professional fees shall be charged to all members admitted in any basic or ward accommodations. So I emphasize the word basic or ward accommodations kasi kapag nag-opt ang member or nag-decide ang member para tumira sa private room is hindi na to covered ng ating insurance program. Hindi babayaran ng PhilHealth yun. Okay. So, under the IRR, yan, more on PhilHealth. And in the PhilHealth Board of Directors, it's mandated by law na meron tayong 13 members. 13 members, 5 ex-officio members. These are the Secretary of Health, Secretary of Social Welfare and Development, Secretary of Budget and Management, Secretary of Finance, Secretary of Labor and Employment. So these are the members that will comprise the Board of Directors of PhilHealth. And we have 3 expert panel members with expertise in public health, management, finance, and health economics, and 5 sectoral panel members representing direct contributors, indirect contributors, employers group, healthcare providers, and representative of the elected local chief executive. So, 13 members ang bubuo sa PhilHealth Board of Directors natin. Okay. And what about the President and Chief Executive Officer of the PhilHealth? So, ano ba dapat yung requirement sa isang President and Chief Executive Officer of the PhilHealth? So, this is from the IRR ha. So, the President or CEO ng PhilHealth is recommended by the board and he or she is appointed by the President. Okay, syempre kailangan Filipino citizen and with at least 7 years experience in the field of public health, management, finance, and health economics or a combination of any of these. So, if you're aware of current affairs na mga nangyayari sa gobyerno natin sa mga panahon ngayon, okay, di ba? The newly appointed CEO of PhilHealth, maraming negative reactions or kina-question yung decision. Okay? Because as mandated by law, this should be the qualification for a CEO of the PhilHealth, President or CEO of the PhilHealth. Okay? So, in our health services delivery, ito nga yung 2 terms na kailangan natin na i-familiarize, the population-based health services and the individual-based health services. Okay? So, di ba, na-expound na natin yan kanina? Okay? And we have here the organization of local health systems. So, under this, UHC, meron tayong integration ng local health systems into province-wide and city-wide health systems. Okay, under this, it says here, provincial and city health boards shall manage the special health fund, and municipalities and cities included in the province-wide and city-wide health systems shall be entitled to a representative in the provincial or city health board. Okay, at present, meron tayong local government unit. Say for example, Munisipyo A. This Munisipyo A has its MHO, Municipal Health Office. So, sa MHO, ang head pa rin nito is yung mayor. Okay, and under the mayor is the doctor or the municipal health officer. And under this, MHO is the nurse, the public health nurse, tapos yung mga ating rural health midwives, down to the barangay health workers. Okay. Ang mangyayari under the UHC, as stated in the IRR, is that meron tayong provincial health board. Okay? Yung provincial health board, syempre province level na yan, merong representatives from the municipalities or cities na kanyang nasasakupan. Okay. Ano tong special health fund na imamanage ng provincial health board na to? Yung special health fund are pooled funds for population-based and individual-based health services. So the income from PhilHealth payments are included here and to be allocated by the LGUs. Okay, di ba sabi natin kanina yung in-explain ko na paano ba nagbabayad yung PhilHealth? So meron tayong package, di ba? So, yung mga babayaran na ng PhilHealth, hindi na siya diretso dun sa munisipyo or sa health facility kung nasaan yung, hindi siya diretso dun sa health facility kung saan nag-avail ng service yung isang Pilipino. So, ang babayaran ng PhilHealth, ang pera mula sa PhilHealth ay pupunta na sa Special Health Fund. And itong Special Health Fund ang i-allocate ng Provincial or City Health Board. Okay. So, the problem will enter, di ba? May nag-question noon in a previous discussion. Okay. Sinabi na, paano kung hindi ka aliado ni Mayor si Governor? Okay, so those are questions that would need answers, diba? As this universal healthcare is being implemented. Okay, and that DOH shall provide grants or incentives to improve competitiveness of the public health delivery system. So, ang role na lang ng DOH, magbigay ng reward ba? Diba? Reward kung good yung ang tawag nito, performance ng isang health facility, okay? DOH will provide incentives, okay? To increase or improve more yung public health delivery system natin. Okay. Ano naman ang sinasabi ng UHC regarding human resources for health? So, kapag you become nurses already, you will enter into public health, okay? These are must-knows, okay? So, under the UHC, it is mandated to create a national health workforce support system. So, gagawin ito ng DOH. In this National Health Workforce Support System, i-prioritize yung ating sinabing geographically isolated and disadvantaged areas, diba? Yung mga barangays na GDAS, okay? So, pag sinabi mong i-prioritize, bakit? Parang yung DOH magbibigay ng support, manpower. At present, pwede nating masabi ito yung mga NDPs natin, mga nurse deployment program, yung ating mga DTTBs, Doctors to the Barrios, diba? RHMPPs, Rural Health Midwives Placement Program. Ito yung mga hinahire ng DOH on a contractual basis. Tapos, ipapadala sila sa mga GDAS, yung mga geographically isolated and disadvantaged areas. Okay. But, one insight here is that it seems like a bandage solution, diba? Kasi these are working under a contractual basis. Or, ang sabi natin is, pinapadala lang sila dun sa GDEL and then, after a while din, diba, hindi sila permanent doon. So, help lang sila. Considered nga support. Okay. Okay, next is scholarship and training program under the UHC. Sabi nung IRR is that i-encourage daw ang residents of unserved and underserved areas sa Pilipinas to have their scholarships or training programs for to serve in public health. Okay, so isa na dito yung, 'di ba, yung ating scholarship for midwives and doctors ngayon under the DOH. So, I for one is under this, yung scholarship ng DOH for med students. Okay, so ano ba yung laman nito? So, it's like they provide you the allowance, okay? They provide you your school needs, kanyan. They pay for tuition, and then miscellaneous fees, okay? And then after graduation, meron tayo itong return service agreement. Kailangan na 3 years you will serve or the scholar will serve under public health. Okay? 3 years. Okay? But I came from a school na ang nire-require naman nila sa amin, the University of the Philippines School of Health Sciences, require us to render our return service 2 years for every stay in school. So if you finish the curriculum, kasi sa amin is abot ng 10 years to become a doctor, so ang return service namin is 20 years. Okay. But yes, maybe you're asking na, is this for free? Volunteer ba to? No. So meron naman sa law natin yung mandate na syempre bibigyan ng compensation. Okay. So, in our school, we have our 80+% retention rate. So, madalang yung mga nangingibang bansa na nagra-graduate na healthcare workers. Okay? So, it's mandated by the law already. And here nga, residents of unserved and underserved areas are priority in this scholarship. So, those who are dreaming to become doctors, you can enter the DOH scholarship. So, pag natapos mo ang medicine, ganyan, magsiserve ka under the DTTB Doctors to the Barrios program for 3 years after graduation. Okay. You will be assigned to the areas na prioritized. Okay. Another term under the UHC is Health Technology Assessment. What is this HTA? It's the fair and transparent priority setting mechanism that shall be recommendatory to the DOH and PhilHealth for the development of policies and programs, regulation, and the determination of a range of entitlements. Sa madaling salita, or in simpler terms, it's one way of ensuring na ano yung mga mai-prioritize ba na interventions. Okay. So, a Health Technology Assessment Committee will be formed. So, sino yung mga tao dito? So, there will be 9 health experts from different fields. Okay. And these health experts will oversee and coordinate the health technology assessment. They will review, tapos i-assess nila yung mga existing DOH and PhilHealth packages, tapos may kailangan bang i-revise, may kailangan bang ibawas, idagdag, okay? So, the HTAC or the Health Technology Assessment Committee will be the one to do that. And this will be created within the DOH as mandated by law. Okay? And then, ang sabi sa IRR, within 5 years after the establishment of the Health Technology Assessment Committee, magtra-transition ito into a separate entity, separate from the DOH, and it shall be attached to the DOST. Okay. So, last slide, malapit na tayong matapos. Sabi dito, okay, where shall the funding come from? Diba? Importante yan na tanong. Parang ang ganda-ganda ng UHC. Okay. So, in here, I've listed where the funding will come from. So, one, is from the syntax collection. So, di ba meron tayong syntax law, yung RA 10351. So, yung mga collection from the syntax will provide funds for the implementation of the universal health care. Okay? Number 2, 50% of the national government share from Philippine Amusement Gaming Corporation, PAGCOR. Okay. 3, 40% of the charity fund net of documentary stamp tax payments and mandatory contributions of the Philippine Charity Sweepstakes Office or PCSO. And we have also premium contributions of members, diba? Na-discuss natin yan kanina. So, ganun kataas yung from the contributions ng members. Sa madaling sabi, hindi ibig sabihin na universal healthcare, libre lahat. The word libre is not applicable. Kasi meron at meron pa rin magbabayad. Okay? And then we have the annual appropriations of the DOH, the national government subsidy to PhilHealth. Okay. So, one issue here that comes up when we discuss UHC, di ba? Malaki yung binabudget for this. But the budget goes to PhilHealth, di ba? And then we could see there yung expenditures. Nakita natin yung pie chart kanina. Yung use of funds. Napakaliit yung napupunta sa public healthcare. Okay? Napakaliit yung napupunta sa DOH na nagagamit for the programs. Okay? So we hope that with this UHC, mas ma-emphasize yung role ng yung preventive and promotive healthcare. Hindi yung magagamit lang natin yung PhilHealth benefits natin when we get sick, when we enter the hospital. So we hope that with this universal healthcare, maging maayos yung kanyang implementation. Pero tingnan natin, di ba? Paglabas pa lang ng IRR niya, hindi rin niya nasagot yung ibang aspeto ng healthcare system natin na kailangan nating iayos. So, paglabas pa lang ng IRR, ang laki na ng negative reaction, especially from our OFWs, di ba? So, we hope that our law can be changed to really cater to the needs of the Filipino people. Okay. Though sinabi ni President Duterte na parang suspend muna yung pag-collect ng contributions, still we have our law na enact. So it wasn't changed yet. So I don't know kung ano yung mangyayari in the future with this. Okay, so as I've said kanina, I'm not really an expert on laws like this, but this is what is inside the IRR and the Universal Healthcare Law. So I hope that you gain a little insight on this topic. And if you want to read more, you can actually download the IRR of the Universal Healthcare Act from the DOH website. You can look for the you can look for the soft copy of the act mismo online and read through it. Okay, if you are interested to know more about this universal healthcare. And it's also nice to know this kasi kapag pumasok na tayo sa work, hindi maiiwasan yung topic na to. Okay, even if you work in the hospital, meron kang ma-encounter na patient na magtatanong kung paano yung sa PhilHealth. Okay? And lalong-lalo na kung nasa public health ka, papasok kang public health, we really need to know how the system works, how DOH works, and how the funding is done. Okay? So with this, thank you for listening, and I hope that you gain an insight in this and you can use this in your exam. But I hope that this won't take up a lot of your exam. So good luck. God bless.